to students. But you know, how much it's transmitted between students is still an open question. We do know that with regard to COVID-19, children are not the same as adults. And we're learning more about that. And Dr. Romero, Dr. Jose Romero, our Chief Medical Officer and soon-to-be interim Secretary of Health, is a pediatric infectious disease specialist and is monitoring those new findings, and we will apply those to the school setting as we get closer to that time.
Is it possible to apply them statewide rather than district by district, or?
Well, you know, each school and each district has some unique features, but the principals, certainly we will make sure that they are incorporated, that they have that information available in making their plans.
Okay. Are we still seeing that 0 to 17 age group growing? I know about a week and a half ago, it was probably one of the bigger categories in terms of growth.
They are still increasing in that group, but it's really the 18 to 25-year-old group that is the leading one right now, and we'll be continuing to monitor that.
Alex?
Last week you said it seemed as though cases in Northwest Arkansas were leveling out. What do you say now with these new cases in Washington County and why they're not leveling out like you hoped?
Well, I think they are, and so I think that trend is continuing. If you look at Benton County, it's clearly going down. Washington County been going down. Today is an uptick in the case there. And of course, and so I think you have seen that progress. I was pleased in talking to one hospital up there that they even saw some leveling out. And so we'll see where it goes from here. It's obviously worrisome when you have, you know, the number of cases today in Washington County. But overall, the last 7 days, I think it showed some progress there.
Do you know where everything's coming from here in the Pulaski County area, or is it just sort of all over the place? Because I know yesterday you mentioned that we're not seeing specific clusters.
Go ahead.
What I can tell you right now is that almost a third of them are coming from Wrightsville, and we think that those are probably most, if not all of them, are from the Wrightsville unit.
2/3 of it then?
Well, 44% are in Little Rock, but we don't have information on specific outbreaks yet. Of course, these are just new reports from this morning.
Is there any question remotely?
Yes, this is Melissa Zigowitz with THB 11. When you look at other states that have required masks for at least 2 months now, New York and Illinois, for example, these are also one of the few states not experiencing a second outbreak. On Sunday, New York logged less than 400 cases, and Illinois has one of the fastest declining positivity rates in the country. Now, Governor Cuomo is now calling on the president to mandate all Americans to wear masks because it's working. Now, my question is, have you spoken to any of these governors to get their perspective on how it's working and how they're enforcing it?
Yes, and you did mention a couple of states, but how about California? California has had some of the strictest rules, and you see their cases going up. So I think you can continue to look at the data. As I talk to other governors, the majority of governors have not provided any mandates, statewide mandates for wearing masks. But more importantly, I talk to Arkansans, I talk to, and I look at the data here, and we've seen a significant increase in wearing masks based upon our strategy of education, of leadership, of encouragement, and showing the difference that it makes. And that has increased the usage of face coverings when you can't do social distancing. So we drive that message. I think you're seeing success in it, and we're going to continue to do so. Another question remotely?
Yes, Governor, this is Garrett Ferguson with KNWA Fox 24 News in Fayetteville. Are you still looking at moving forward with the nursing homes reopening, planning starting tomorrow? The Washington County coroner has voiced his concern about nursing homes reopening, especially here in Washington County, with the number of cases increasing. Are you looking at that reopening again?
If the nursing homes meet the criteria that we set and that CDC guidelines, then we go ahead and plan on continuing to reopen them to allow visitors with the restrictions and guidelines that have been set. It looks like probably about, I think a majority of the nursing homes will be subject to that reopening, but there will be a significant number that will not meet the criteria because they've had a positive test, and the new CDC guidelines provides that to reopen a nursing home, there should be 28 days without a positive case. And so we will be following that guideline as part of the direction to the nursing homes as they try to open up visitors to the loved ones. And Dr. Smith, did you want to add to that?
As the governor stated, that is the major change, is to, if there's been even one case amongst either a resident or a staff member, then the CMS guidelines are to wait 28 days before allowing visitors. And that's different than what we had put forth, but we are incorporating that in just to be consistent with our federal colleagues and also out of an abundance of caution. I know that that is going to exclude some of the nursing homes from allowing visitors that had hoped to, and they'll just have to wait longer. To give you some perspective, as of yesterday, we had tested over 40,000 residents and staff in long-term care facilities. We have results on 326, and of those, as of yesterday, we had 59 that had at least one case amongst a staff member or a resident. And so, for example, those 59 will have to wait 28 days until they until they don't have any additional positive cases. But there are still the majority that don't have any cases, and they will be able to, under the limitations that we put in our guidance, will be able to start allowing visitors.
Alex?
How many of the contact tracing investigations are unable to find a source?
The contact the contact tracing is actually looking for contacts, and there are some times where there are no contacts. Someone didn't have any contacts during their infectious period. If you're talking about the case investigations, trying to find where that person became infected, we have had, it's running around 25%, about a quarter of those we've not been able to link them with a particular exposure. We're trying to work to reduce that, but that's where we are right now.
Yes.
If the state of Arkansas sees a significant increase in the number of new cases, would you consider implementing a statewide mask order to wear masks versus shutting down again?
Well, we'll consider anything that is supported by good science and information and that we believe will work. Of course, when you look statewide, there are still one or more counties that have 0 cases. There's others that might have 1 active case. And so, for a lot of different reasons, I don't think that is right. So we'll look at the data. If we need to make adjustments, we will, but I don't expect that to happen in the near future.
Maybe, I know it's maybe getting ahead of here, but when can we expect a contact sport directive? Because, I'm ready to ball just as much as you are.
Well, that's right. And let me just add to that it appears to me that, there's some of our athletes that are in summer sports that are going to Oklahoma and Texas. And I don't know how they're doing that, but it seems that they're playing with their guidelines maybe a little bit looser in some of the other states. But I'm anxious to play. We'll continue to look at that. But because we have it on pause right now, until we get these cases down, then I don't expect the movement to take place for going to a phase 3 or for opening it up for those additional contact sports. I'm anxious for that to change, and hopefully we'll get there if we all do our duty and do our responsibility. And I do get messages from people that say, whatever it takes, let's do it so we can get to sports next year. We want to do that, but we got to be smart, and we got to get this under control. Alex.
Will the Department of Health be releasing a specific directive for schools? And if so, when can we expect that?
A specific directive for schools? Well, we already are working very closely with the Department of Health and Department of Education that came up with the blended learning environment and the guidance that is being put out. They'll continue to work together. Do you have any more specific on that, Dr. Smith?
Ready to learn.
Yeah, it's the Ready to Learn. That is the guidelines of the Department of Health with the Department of Education combined. So anything you see coming out of the Department of Education with the schools will be in partnership with the Department of Health and with their blessing. Maybe a couple more questions.
The status on the contact tracing contact.
The contact tracing contract. Dr. Smith, what's the latest on that? Are we moving on that?
Yes, we've selected the number 1, and then as we get...
well, you're going to have to come to the microphone.
We have selected the number 1 from among our choices, and then as soon as we're able to get the additional funding and authorization for that funding, we'll go ahead and specify the number 2. So we'll have 2 contracts for contact tracing, and that will. Initially, we want to move as quickly as possible with the first one because we already have the funding and authorization for that. That will add 350 to our army of contact tracers, and then when the other one, assuming we're able to get the funding and authorization, that will bring on another 350. So we'll have 700 additional contact tracers to supplement our workforce.
So that first contract, how soon are they going to be able to start working?
They're supposed to start as soon as possible, and hopefully have some activity going on even this week.
Secretary Kelly, 2 weeks ago, she had told one of the legislative committees that she had asked for the budget cut in fiscal 22 to her agency to be restored, and that was rejected. Was there any disagreements on budgets that was behind her retirement?
There was absolutely no disagreement in policy and direction and coordinating. So that I was as surprised as anyone yesterday with her coming to me and indicating she's submitting a resignation, and I accept her reasons at face value. And Secretary Walther might be able to dig in and learn a little bit more about that, which is a surprise to me. All right, yes.
Something non-COVID related here. I guess with the Medical Marijuana Commission kind of having some drama the past couple of weeks, do you have a stance one way or the other on the potential of issuing those last 2 cultivation licenses, or?
I know that they're meeting, and that's a decision that the Marijuana Commission must make as to whether to grant any additional cultivation licenses. To me, the most important criteria is whether there is a need for a greater supply. If there's not a need for a greater supply, then there should not be the licenses issued. If there is a need for a greater supply to meet the need of patients, then that is something that should lead to the granting of licenses. And so that's a decision that they make, but I trust that they will make it based upon that data as to what the needs are out there of the patients in terms of the supply. Thank you all very much. So